Staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
This episode is brought to you by Gainswave. Gainswave is a treatment done at your doctor's office to optimize erection quality without the need of Viagra, Cialis. It's non-surgical, there's no needles, and it has an amazing success rate. To find a Gainswave provider, go to gainswave.com. That's GAINSWAVE.com. Thank you. This is Mark White with Health Hacks, and I'm here today with Dr. Christine Schaffner.
Yes. Yep.
I hope I said that right. Christine Schaffner is a naturopath from Seattle, Washington, and seems to be a lot of naturopaths in Seattle. Why is that?
You know, we have one of the universities that trains naturopathic physicians. So Bastyr University is a leader in naturopathic medicine, and then a lot of us come to Seattle for that reason, and then we fall in love with the city and stay here. And, you know, naturopathic doctors also are unique in that we have different licensing scopes depending on what state we're in. And Washington is one of the most advantageous places for us to live because we have a really broad scope of practice and we're treated like real doctors, and we can help a lot of people in the state. So that's why you see a lot of us here.
What's the biggest difference between a naturopath and an MD?
It's a great question, and I think the functional medicine docs are trying to bridge that gap, but naturopathic medicine is definitely a unique form of medicine in that we're trained in looking at the root cause of why people are sick today. And so I had to go through all of my undergraduate and pre-medical requirements, but then the training is a 4-year program where we do all of our basic sciences and we get a lot of the foundational basic anatomy, physiology, cadaver lab, all of that, but our tools are very different. So we are trained in pharmaceuticals, but and minor office procedures, but we are trained in a very big toolkit where we use supplements and herbal medicine and IV therapy and all these detoxification tools like lymphatic drainage and colon hydrotherapy. And, we have this wide toolkit to really look at someone's illness is not just a label, but how can we really restore function in a number of systems. So it's a really unique form of medicine. I think people are looking for it more and more. We're still a very small profession, but I'm so happy that I decided to go that path because I really focus on the treatment of chronic illness. And I think, naturopaths are so well positioned to really help people recover from a chronic illness because of our approach and our toolkit.
Is it different from functional medicine? Naturopath?
Yeah, so functional medicine is great. It's awesome. And I feel like functional medicine is such a necessary movement. Functional medicine is going to be more aligned. A lot of the medical doctors or, the conventionally trained doctors, they see their limits, within that paradigm, and they're looking for something more. And functional medicine is looking at, the root cause as well.
Right.
Different language at it than we do, but they look at the same factors. We're all looking at, why are people so sick today? And it's really a combination of, these chronic infections and these stealth pathogens that people are, riddled with. So from that's Lyme and co-infections, viral and retroviral infections, parasitic infections, fungal infections. So we look at that. Functional medicine is really test oriented. So they have a lot of specialized labs that are going to look at that.
Uh-huh.
And then we look a lot about the environment, right? So how is the environment impacting our immune system and our organs of elimination and, our brain, our heart, our cardiovascular system. So we look at heavy metals, they do as well. We look at pesticides and glyphosate.
It's really what you're talking about. It's like just detoxing the body.
Mm-hmm.
So when like a patient's calling you though, like, is it because they're sick or is it because they don't want to get sick? Like tell me what's your typical patient like?
So my typical patient is someone who's already sick. So I see someone who's seen 20 to 30 doctors. I often, when I do these interviews, I even mention that I was someone's 54th doctor before. So
Wow.
we see people who have just not, their illness and the language that's needed to recover their health is just not part of the paradigm in conventional medicine. So they've gone to, the specialized Mayo clinics and the Cleveland clinics, and they're, just left with a lot of unanswered questions because while there's some pathology that shows up on objective tests like just regular blood tests or MRIs and things, it doesn't tell the full story. And then the tools that medical doctors have are very limited. I think neurologists are, brilliant doctors and so well trained, but they have a toolkit of maybe 5 drugs and, some other, very, aggressive options. And so, our patients are looking for another approach, and also really they're still on a quest to understand why they're really sick. And we provide that for them.
So when they see you, like, are you talking about people with things like cancer, heart disease, really serious chronic diseases?
Yeah, so we don't see cancer as much, but we see more neurological illnesses or just that kind of bucket diagnosis of fibromyalgia, chronic fatigue. We'll see in the neurological realm multiple sclerosis or ALS or cognitive impairment of any kind. But it's just the patient who just does not feel well and has not felt well for a long time. They have a lot of symptoms from brain fog to maybe migraines, respiratory issues, digestive issues, anxiety, depression, insomnia, all of these things that we can trace to some fundamental common denominators.
At the end of the day, though, when you look at the root cause, it usually comes down to like food, environment, anything else?
Yeah, I think food is, of course, huge. I think our food supply has a lot to be desired in our country, but I think it's deeper than that. I think that often our patients have tried these wonderful diets that are so foundational and important, but it's not enough anymore to get people well. So I think it's really the impact of the environment on our health and how that affects, so many systems in the body and our just ability to eliminate properly. And that is, as you've already mentioned, one of the key components of health. And then because of the environmental toxicants that we're all up against, they have a huge impact on our immune system. And so our immune systems have become less resilient, and we are more susceptible to opportunistic infections that can really take their toll on our physical bodies.
Okay, then, so when you see somebody, you're basically prescribing supplements, or do you also prescribe traditional Western medications?
Yeah, we're really integrative. So even though I'm a naturopath and in the state of Washington, I can prescribe drugs. And so we do a combination of modalities. And, it's really, Mark, it's doing things with the right intention, right? We want to do the right therapy at the right time for the right reason, right? And so, I think prescription drugs have a place, especially in the world of antibiotics or antifungals or, hormone replacement or what have you. There are some really tried and true pharmaceuticals that we use on a regular basis, but we do that with the right support, and we do that with the acknowledgement of how can we make that the most effective and the best tolerated so the patient can have the best result. And, as a naturopath, we're trained in something called the therapeutic orders. So in a nutshell, it's like we want to meet the strength of the disease or the strength of the pathogen with the right force of an intervention. And, when you're full of mercury, you can, drink cilantro and, do all of those things. But sometimes, when you're, of course, under the medical supervision of people who know how to do this, you might need chelators and man-made, synthetics to get these things out of
What is a chelator?
So we look at heavy metals, right? So heavy metals, when we think about heavy metals, they are neurotoxic. They have a huge inflammatory effect on our bodies. So things like mercury, lead, aluminum, arsenic.
How are we getting these into our body?
So many reasons, but, many people, at least this is coming out of, this is not as in vogue anymore, but amalgam fillings are essentially mercury, very close to the brain. So we do a lot of dental health and help people to safely remove their amalgam. So mercury we can be exposed to mercury from amalgams, but also, from our food supply, from fish, from coal burning, and from China. So on the West Coast, our air, can be, we can be exposed to mercury. Mercury is taken out of a lot of the vaccines, but thimerosal used to be a preservative in vaccines and also in contact solution that was a source of mercury. So mercury is a big one. When I think of heavy metals, there are a lot of them, but I think of mercury, aluminum. Aluminum is a really big one.
I know, because I know mercury is like big with tuna and fish and.
Yeah. I mean, I think that's absolutely a big exposure, but the mercury that we're most worried about is the mercury that, can be in the mouth or that can be injected into the body that we're more vulnerable to. And so, but yeah, we have to absolutely look at all of the exposures, because when we detox people and we use something like a chelator, one of the biggest things that we want to do is avoid exposure and kind of limit the exposure, so then we can start reducing our body burden.
Is there a blood test that everybody should be doing to see how much heavy metals and toxins we have in the body?
Yeah, I wish that blood tests were the full story. The hard part about heavy metals is they affect us in different body systems. So if you draw your blood and you have a high mercury level or lead or aluminum, you're really pretty acutely exposed and pretty toxic. What the body usually does is when we're exposed to metal, we store this in different tissues to protect ourselves. And so lead often gets stored in bone. Mercury can be in neurons or in, affect different parts of our central nervous system. So can aluminum. Aluminum can do all of these things, and of course they can affect our gut. And so what happens when we really do a proper test for heavy metals, we give someone something called a chelator, which is a metal complexing agent that's going to have a special affinity for these metals. And then we often, the traditional way and kind of standard for functional medicine docs and people who are trained in environmental medicine, is we give somebody a chelator like DMSA or an injectable like DMPS or EDTA, and then we have them collect their urine for about 6 hours, sometimes 24, and we see what the body excretes given a chelator that has a special affinity for lead, mercury, arsenic, cadmium, and then we go from there. So, there's no perfect heavy metal test, and that's why a lot of these things, you need to go to trained doctors who can interpret these things for you. But, metals are, I'm kind of biased with the work that we do. I think all of us are exposed to heavy metals. Of course, some of us are going to be more vulnerable and susceptible and don't get rid of them as much. But I think to lead a healthy lifestyle and a lifestyle prevention, having some detoxification protocol or kind of lifestyle is important.
Because what you're saying is that you can't avoid the metals, but you can detoxify. How do you do that?
Mm-hmm. Yeah, so we're always looking at supporting your organs of elimination. So with whatever we're trying to get rid of, we want to make sure the kidneys are in good health and are supported. We want to support the liver and the bile and the colon and the lungs and the skin, and there's lots of ways to do that. We use binders as a foundational strategy, and binders are going to be things like chlorella or modified citrus pectin or charcoal or clay, and they help to bind the toxicants and metals that are coming out of the bile, entering into the intestines, and sometimes that gets reabsorbed. But if you have binders in your gut, you're going to be able to eliminate those through your colon and through your stool. So it's enhancing the route of elimination. So we always want to do that. And of course, in the backdrop of good mineral repletion and electrolytes. And then there's lots of ways to get rid of metals. Some people go on a chelation protocol with a lot of support around them. Some people, we just use herbs. We use different herbal compounds, cilantro in particular, that can help to mobilize metals. Melatonin, actually, Mark, is an agent that helps to do so many things, right? It helps with sleep, but it actually has a profile that it's neuroprotective, and it can help remove heavy metals from the brain, which is very hard to do. And so we use melatonin as well as one of the agents to get rid of metals in the brain.
Do you get a lot of people that come to you for brain function?
Yeah, most of our patients. Yeah. So we're specialists in brain health and neurological illness. And, one of the fundamentals that whenever I get the chance to talk on these things, I always like to educate people. We know about sleep and how it is, of course, great for our health, but it's so important for our brain health because our brain actually is wired to detoxify at bedtime through a system called the glymphatic system. And that's our lymph drainage system in our brain that only works at bedtime when we're in a restorative sleep. So we have all sorts of ways that we help people enhance that that, but it's a foundational piece to having a healthy brain.
So what are some ways, like I don't sleep well, like if
Uh-oh.
I sleep, I mean, I track my sleep. I get 4 to 5 hours of sleep a day. And
Yeah.
people say you need 7 hours of sleep, even though I feel I get by. If I have 6 hours, I'm happy.
Yeah.
I come to you. How do you help me sleep better besides taking melatonin?
Yeah. Well, one of the things, that is getting a lot more awareness these days, Mark, is we actually pay a lot of attention to the electromagnetic environment and the sleeping location. And so we're inundated, right, by cell phones and Wi-Fi and all of these technologies. And of course, they make our lives very connected and informed. And there's a huge upside to technology, but there's a cost, and we're not, it's a cumulative exposure over time, and we're just none of us are getting a break. And so what I have people focus on, and what I've seen really, really help people sleep. Sometimes people are skeptical, but they'll listen to us anyway and be surprised about how their sleep improves. So we look at, for our patients, we have them turn off their Wi-Fi in the house, only use it when they need it, or turn it off at least when they're sleeping. Dr. Klinghardt, who I work with, he says no Wi-Fi in the home, especially if you're suffering from a chronic illness. And then, of course,
my kids would revolt if I turned the Wi-Fi off.
Yeah. Well, it's cumulative, right? So when they're not using it, it should be turned off. And when everyone's asleep, hopefully no one's using it, while they're sleeping. And so the, turning it off at least before bedtime would be the first step. And some patients have their Wi-Fi router on a Christmas timer, so then they don't have to worry about thinking about that every day. And a lot of the routers now are easier. They don't take as much time to power up and all of that. But it especially if you're struggling. I mean, people who, we see they're really committed to trying these things that sound a little bit out there because they're suffering and they want to feel better. So, we have people look at their Wi-Fi environment, their electromagnetic field environment in their bedroom. And if that just feels too much, at least start looking at blue light exposure before bed. Our pineal gland is so sensitive to light, and that's what regulates our circadian rhythm and communicates to our brain to have sleep and also to produce melatonin. And so if we're giving it mixed messages and giving us this stimulating blue light before bed, we're going to be more wired before bedtime, and we're not going to produce these things, in a mindful way. And then we look at, all sorts of things. Why is your brain overactive and not going to bed? There can be a viral load in your brain. There can be metals in your brain. There can be all sorts of things. There can be unprocessed trauma that we're all, working with as well, that keeps us up at night. So it's multifactorial, but there's so many tools, from melatonin, creating a safe sleeping location. CBD is a big topic nowadays that we use a lot of, especially depending on what state you're in, what kind you can get. But CBD products. And then there's a whole host of natural products too that can help calm the brain and calm whatever the factors are that are keeping your brain awake at night.
Are you using a lot of CBD and THC out in Washington to treat patients?
Our patients come from all over the country. So, we have access for Washington residents that they can get, it's recreational in our state. So people can go without a medical card and get products. And so if people have access to that, there are combination products that are a combination of CBD and THC that do work well for patients who need to sleep or who have pain or anxiety or inflammation. If you don't live in a state where that is accessible, there are hemp-derived CBD products that can be anti-inflammatory and that can help with sleep. We work closely with a company called Quicksilver. Dr. Chris Shade is the director there, and he's created some wonderful CBD products, plus combining them with herbs and liposomal delivery to help, from anything from immune function to anxiety to sleep. And those have been fun to work with.
I can imagine. How did you get into this? You were a psychology major, right?
Yeah. I was a psychology major, and I went to University of Virginia. I grew up on the East Coast, and it's probably a long story, but in a nutshell, I grew up around medicine. My father's an oncologist. My mother has a nursing background and worked in university hospitals, and so I was always around medicine, and I always wanted, to help people. I think what I struggled with was the way that I wanted to do that. And when I found naturopathic medicine, it really spoke to that part of me that wants to help people really look at the real reasons why they're sick, and have just this other toolkit of really helping people heal on many levels, rather than just giving them a prescription and seeing them in three months. I develop relationships with my patients where I see them for a few years because of the work that we do, and so we do a lot for people, and it's really rewarding work. And I found my way out of school, though. I graduated in 2010, and when I graduated, I started working with my mentor, Dr. Klinghardt, right away. And he's about 70 years old. He's a medical doctor, a PhD from Germany, and he thinks very outside the box. We do a lot of outside the box things at the office, and so that was my first experience in my career, and I've stuck with that. And we still work together, and we help people, and it's just been it really set me on this especially niched path of helping people with chronic illness.
Nice. What are you working on now? What are you passionate about?
There's a few things that I'm really excited about in medicine. I did a summit last year called the Body Electric Summit, and it was all about this combination of using biophysics plus biochemistry to recover people's health. And I know with the work that you do, Mark, you know that our bodies are more than biochemistry, right? That we respond to all of these other tools and therapeutics and technologies that are beyond supplements and pharmaceuticals. And so I'm, really into concepts around exclusion zone water, and also photobiomodulation, and also something called photodynamic therapy, so different applications of light. Dr. Klinghardt, one of his methods is based on Fritz Albert Pop's work and the whole idea of our biophoton emissions in the body. Not to lose anyone with all of this, but it's exciting. I think that there's so much more to our health and how our bodies function and communicate. And I think that there's so much, research to, not make these, they're not esoteric ideas anymore, right? They're grounded in science, that our body does communicate with sound and light and vibration and frequency. And so I just see that these tools have the ability and the capacity to really accelerate our patients' healing. And, that's what I really want. I mean, we do a lot of great work. We help a lot of people, but I still get frustrated. It takes too long and it's too expensive. And however we can just shorten that path and make the most elegant path of healing for our patients. And I think this approach has the capacity to do that.
So if somebody wanted to get in touch with you, do you do consultations via Zoom or just in person?
Yeah, we establish care in person just because of the nature of the work. So often people come either for a day or a week even, or longer, depending on their needs. And then we can maintain communication on the phone or via, video with our EHR. So it is, we also have a really great teamwork. So I work with a team of doctors and medical doctors and chiropractors, and, we all work together in a team environment to help people. So our clinic is Sophia Health Institute. It's outside of Seattle, Washington, and Woodinville. And we just have a lot of wonderful therapeutics to help people get better.
Awesome. No, that's exciting. What we'll do is we can include links and get our listeners to reach out to you. I really appreciate your time.
Yeah, no, it's so nice talking to you, and I really appreciate this opportunity.
Thank you so much.